Thanks, everybody, for being here. My name is Kim Porter. I'm the Executive Director of Be a Part of the Conversation. I'm very glad that you joined us. This is the first time that we're talking about motivating change. We've talked about it, kind of danced around it here and there in lots of programs, but we decided it was time to really dive right into how perhaps we can be the influence in someone's life that helps them. We always talk about leading a horse to water. We can't make them drink the water, but we can hopefully get them to the source of that water. So that would be why we have such amazing panelists on this evening, and I'll tell you more about them in just a moment. First, I want to thank the wonderful support that we get from Bucks County Drug and Alcohol Commission and the Chester County Drug and Alcohol Services. We rely on these folks. We have really nice partnerships with them, lots of programs throughout the year that they fund, and this is one of them. So thank you very much to those partners. We are a nonprofit organization. We do rely on contributions to stay afloat, so please do consider making a contribution. You can follow up on tonight's program by visiting conversation.zone/families. I'll share this in the link as well. That's where you'll find this recording and any other resources that might come up from our guests tonight or speakers. Anything that they mention, I'll be sure to add that to the follow-up page. We have a page on our website that has a calendar of all of our upcoming programs. So I hope you'll check that out. And we have recordings. This will be one of them. We have more than 190 currently on our YouTube channel. So please visit convo.zone/YouTube and please hit subscribe to follow us and get alerts when we have a new program that gets posted. And especially for this audience tonight, I have a feeling we have a lot of friends. I believe we have some friends visiting from our Doylestown Parent Partnership meeting. I think they were going to join us live tonight. So we have meetings, 21 meetings every week that are called Parent Partnership. About half of them meet in person and about half meet online. The page on our website that has all the details about that is conversation.zone/partnership. So if you click on these buttons, if you click on the green buttons, you'll find the Zoom meetings and the links and all of the information you need there. Purple buttons are the in-person meetings, so you'll get the address and so forth. There's no charge to attend these. There's no need to register. You just show up. You don't have to come all the time. You come whenever you feel like it. We'd love to have you. We also have, also totally free to attend and participate in, is our family recovery course. We're entering our 4th year of this course that we developed about 4 years ago. It is a 3-part course that is peer-led. I'm one of 18 instructors. There are 2 instructors for each course. These are mostly held on Zoom, but you can learn more about that at conversation.zone/FRC. And we have had tremendous outcomes with this course. We're very, very proud of it. People are getting connected to all of our services through this course. So we're really grateful to the folks who have participated and have stayed engaged. So I'm very excited about the folks who are joining us tonight because we have some kind of newcomers for us and one very dear friend of mine, Pat Connors. But first, I'm going to tell you a little bit about Brenda Carpenter, who's also a friend, but a bit newer of a friend. Brenda is a certified family recovery specialist and a certified ITC group facilitator, which stands for Invitation to Change. In addition, she's currently working toward national certification as a health and wellness coach. Underlying all of this training is motivational interviewing, the evidence-based, person-centered approach that focuses on evoking and strengthening an individual's own reasons for change. Practicing this method in her own life, Brenda has noticed significant changes in how people respond to her. They're more appreciative of the opportunity to speak openly about the challenges they face and are more motivated to work toward the changes they'd like to see in their life. This positive reinforcement continues to fuel Brenda's desire to accompany others on their growth journeys. And I'm going to tell you, we're going to hear from Brenda first, but I'm going to tell you a little bit about Pat Connors. Pat is a certified addiction counselor, a certified intervention professional, and a BALM, which stands for Be a Loving Mirror, family recovery life coach. She worked as an addiction and mental health counselor in private practice and at inpatient and outpatient treatment facilities for 25 years. For another 10 years, Pat worked in community outreach, recommending treatment facilities that would be appropriate for an individual's specific needs. She has particular expertise and ability in working with families that are suffering as a result of their loved one's addiction or mental health disorder. She has lived the journey herself with many family members suffering from addiction. Her dedication to helping families recovery is what drives her to do this work. And when we hear from Pat, we'll also hear from Thomas. And I'm going to let the two of them, I'll let Thomas tell you about himself.
Yeah, let me just, thank everybody for being here and all that you are doing and all that you've done to show up and support your loved one. And your efforts and willingness matter, and you can make a difference. And sometimes you can make all the difference. So I just wanted to share that and thank Pat and Thomas for being here as well. And just to be fully transparent, this is the first time I have sat on a panel and put a presentation together. So I feel like I'm about to take the training wheels off of my my certification and jump in. So I hope we can, co-create an experience. And if you have, take one thing away from this evening that you can use, some bite-sized piece that resonates with you, then I feel like I've done my job. So without further ado, we'll walk through the slideshow here. And so motivation to change, mobilizing your loved one's own reasons for change. And we'll go back, sorry.
Oh, I'm sorry. And it's cut off? Shoot, I'm sorry that it's cut off.
Yeah, and then the quote at the bottom is, it's not our job to insert motivation into people. It's to help them find it themselves. That's a quote by Dr. William Miller. A lot of people know him as Bill Miller. He co-founded, co-originated motivational interviewing, which I'll be speaking about and talking about the core components, the spirit, and why it is it right there. Help your loved one find their own motivation to change. And gets the slides cut off there a little bit. People are more persuaded by what they themselves say than what someone else tells them to do. From there. Okay. We can start here. Less fixing, more listening. What most people need is a good listening to. And that certainly has been my experience over the past 10 years as I've supported my loved one along their journey to recovery and as I have recovered, myself at the same time. So let me just talk a little bit about motivational interviewing. It's not a one-size-fits-all, but rather a flexible framework that can adapt to the unique dynamics of your relationship and the specific challenges your loved one faces. The key is to maintain an empathetic, non-judgmental, supportive stance throughout the process. By empowering your loved one to explore their feelings, fostering autonomy, and collaborating on their journey, you can help facilitate meaningful change and support their path to recovery. And even though the journey can be challenging, your consistent support and understanding and patience can make a significant difference in their willingness to seek help and ultimately embrace recovery. So listening is where it all starts. Listening with empathy. It's an active listening. You get them. It's really as simple as that. And when people feel heard and they feel supported in a non-judgmental way, their response to you physically can see them change. And that's been my experience and a very strong reinforcement, when I'm engaging with my loved one and others. So when you focus on truly understanding your loved one's experiences and allow them the space to explore their thoughts and feelings, you send them a powerful message. You matter to me. I want to understand what you're thinking and what you're feeling. What you say and mean is important to me. And that's a really uplifting message to send to your loved one, that you're there, you hear them, you get them, you take yourself out and you focus on them in a open-hearted, open-minded way. So here we are, listening well. a few points to go over. Shift focus. Be present. Give them your undivided attention. No distractions. And I know we have a lot of distractions in our world now, but you really want to be there and have them be the focus of your attention. Creating a safe environment. You want to keep the conversation free from judgment or criticism. Open your heart and mind and hold their words with care and compassion. Be patient and allow silences. Allow for pauses in the conversation for them to gather their thoughts without interruption. And this does take practice. And the first few times you do it, you feel like you want to jump in. The pauses can be uncomfortable, but it really does allow the person you're speaking with time to process, as I say there, gather their thoughts. That's really what they're doing. You're offering them a reflective space, and they need to know they have room to sort of swim around in that space safely. Avoid jumping into problem solve. Focus on understanding their feelings. They probably just need to be heard. If advice is needed, ask first if they'd like to hear your suggestions. That is probably one of the most difficult things when we hear things that our loved ones are telling us. I know my automatic response was, oh, I know what to do. I know what you should do. This would be a great idea, so on and so forth, or just insert your opinion about their behavior. And I've learned through practice to focus on their feelings. What are they thinking and feeling, and the meaning behind what they're telling me? And sometimes just being silent, again, I was amazed when I first started changing the way I communicated with my loved one, that I said very little. The less I said, the more they said. I was able to gather more information. They started, it's almost like free writing. They just start talking, and you that's what you want. And you're just nodding and being engaged as best you can. And express your commitment. You're basically doing that by actively listening, letting them know that you're there for them. Another quote by Bill Miller and his partner Steve Rolnick of Motivational Interviewing: "You can't make someone change or grow, although you can provide the conditions that make it more likely." And that to me was a really powerful message as a parent. And certainly professional therapy has its place, and peers have their place, recovery peers. But parents really are the front line. We generally are the person that spends the most time with our child. We know them the best. The opportunities are there. And for the longest time, I wouldn't take those opportunities. I would just not go there. Not being in denial, but not also being courageous enough to take the first step. And I know that, again, as I've changed in my communication, I have become part of the change process for sure. Helping with words. And this is from the Invitation to Change, which is out of the Center for Motivational Change in New York. Communication is powerful. Effective communication may be the single most important factor in improving your situation and helping your loved one. Words, how they are spoken and received, matter. They can tip the motivational scales towards growth, or they can send someone backwards into troubling patterns. And the Invitation to Change is a evidence-based, so it's sort of science, kindness, and compassion all rolled into one. And it was co-founded by Jeff Foote, Ken Carpenter, and Carrie Wilkins. They are all psychologists who have been working in the field for over 20 years. They've studied motivational interviewing, and they take aspects of motivational interviewing, and they also add in, if any of you've heard of the CRAFT, the community reinforcement and family training, and have created a model that, again, is very helpful, helping with awareness, understanding, and action. So here we are now, from listening to words, what we say, using open-ended questions. Open the conversation by inviting self-exploration, such as what's on your mind, what would you like to talk about, how do you feel about, Those are just a few examples. There might be something specific that you know you want to talk about or they want to talk about. But if not, sometimes just coming to the table with something open, very general, can offer that safe space for someone to talk about what they want to talk about, not what you want to talk about. Be the mirror. Ask questions that prompt self-reflection to learn more. What's important to you? How do you wish things were different? What do you think you need right now? And what do you hope for it? What do you hope for in the future? So again, this really highlights you're literally holding up a mirror and having them giving them that opportunity to reflect back and think about what do they want. Every single one of those questions supports their autonomy. What's most important to you? How do you wish things were different? What do you think you need right now? What do you hope for in the future? And that really does land and makes a difference in bringing them on board and taking their autonomy and giving them agency and building that connection. And then lastly, demonstrate empathy. Validate their emotions and reflect understanding. You're feeling really overwhelmed. I can imagine how difficult this is for you. I can see why you feel that way. And you're really upset right now. And the last one, just on a personal note, that was reflecting back to somebody that they're upset was not something I ever thought you should do. I was more of the impression and practice of change the subject. It's not that bad, sort of, move over quickly. And I've learned and I've had the experience when the person I'm dealing with, and it doesn't have to be my loved one, it can be somebody else now because I practice this way of communicating all the time. It's just become a part of my life. If somebody's really upset, that is what I say. You're really upset now. And it's truly amazing how they're like, yeah, I'm really upset. This really me off. And then you just be quiet and they start talking. And then I've literally had conversations now where I just keep reflecting back. Wow, that was really difficult to hear, and just going on from there. So I just wanted to sort of share that personal experience that reflecting back some of those difficult, challenging feelings helps to validate them, and it helps your loved one to feel like it's normal. I feel this way, and that's okay. And that can really help. That really goes a long way for them feeling like this is a safe space for me to share. And here we go to evoking their motivation to change. And some of you might have heard of the OARS communication skills, standing for open-ended questions, affirmations, reflections, and summarize. So open-ended questions, what you can ask can evoke a desire to change. So now, once you start sort of practicing this, and if you're interested, there's a lot online about motivational interviewing, lots of videos and the like. You see how you can start to intentionally, through your questions and your reflections, guide the conversation. You're not forcing anything. You're not persuading anybody. Again, you'll see the word, what do you hope for yourself in the future? How are your current habits affecting you right now? And again, you find your own conversational language within this, but you're opening up the door, for them to talk, and then you're just quiet. You're doing the listening thing. Affirmations, what you reinforce, like strengths and efforts, helps your loved one to feel more capable. Things like, you're working hard to figure this out. You care about your future. I appreciate your honesty. And again, it never really thought of affirming an effort. But when they hear that back, even the smallest effort, the honest communication that they have, you reflect that back, it is a gift. And I know that I've read in the motivational interviewing coursework that I've taken that affirmations and supporting autonomy are the two most powerful communication tools in the motivational interviewing core, practices. So if you don't know what to say, try and find a strength, an effort, an intention that you can reflect back to your loved one, and you'll get some points. Reflections. What you choose to reflect makes a difference and can help your loved one feel understood. So while they're speaking, you're listening for, what's the most important thing are they saying? What do they really mean when they say this or that? And a reflection is, obviously you're reflecting back, but you're also kind of thinking about, again, what do they mean? And you may get a little bit wrong, and that's okay, because they will correct you. And then you're like, oh, thank you. That makes sense. So again, you're a little unsure of your next steps. And at the same time, you want things to be different. So that's like a more complex reflection. But I wanted to put it in there because often it shows the ambivalence. It shows the process that they're going through, which we all go through in a change process. All change begins with ambivalence. We don't just jump into something and go, yep, I'm doing it. It's like, oh, maybe not. So yeah, you're unsure of the steps, but at the same time, you want things to be different. So you're highlighting at the end what they want, what that's evoking. It's called change talk. If they've said, yeah, I don't know what to do, but this sucks. You can take that and yeah, you want things to be different. And then again, be quiet and they'll talk. And summarize what you highlight can influence the motivational balance. So they're giving you all of this information and you're just feeding it back to them, but in very intentional ways, very non-judgmental. There's no opinions that I'm inserting here, and there's no forcing. So I came up with, you see several benefits in staying sober, like feeling better, not late for work, you improve your relationships. You've given this a lot of thought. Again, that's an affirmation of an effort, right there. And then the bonus follow-up question, because you're always trying to move somebody towards action. What would you like to do next? So again, you're always putting that ball back in their court. And when you give them time, they usually have some idea. And again, even if it's a small step, you're giving that opportunity for them to think about it. And then back to sort of a general, another additional definition here. Developed by clinical psychologists William Miller and Stephen Rolnick, MI, as it's commonly known, is a communication style that helps people change and grow. It's a way of talking with them to strengthen their own motivation and commitment to change. And then I get asked this a lot, is MI only for professionals? And people may believe that only trained professionals can use MI effectively, but the research shows that family members, friends, and peers can also apply MI principles to support loved ones in making positive change. And adopting the spirit of motivational interviewing will help you to have better conversations with your loved one, and you'll feel better too. And that certainly has been my experience. When you really want to watch and listen for the responses, and that starts to lift you up. And for me, it aligned with how I wanted to communicate with my loved one. No more yelling, no more back and forth. If you take the position opposite them, you're in a tug of war. I'm not going to get into the whole too deeply into the resistance and ambivalence and all that. You could do whole workshops, obviously, on that. But just the experience that I've had is I can walk away from a conversation, and as I did recently, and my child said, "Thank you for listening." I had never heard them speak those words before, and it meant everything to me because I'm still learning this myself. I can get caught up in, what should I say? But I'm trying, the more I practice, the less that is happening now. And even though I can be, not have my thoughts in order as I'm speaking now, when I'm with my loved one, yeah, I feel that connection, and I can be there, and I can work through this, and it is making a difference. And like I said, I feel better about our communication and the change that it's bringing about. So thank you, everyone.
Thank you, Brenda. Great job. I really appreciate it. You did not seem like that was your first time at all. So thank you. All right. And Brenda's going to stick around for questions. So that will be ahead after we hear from Pat and from Thomas.
Hi, everybody. Brenda, that was great.
Okay.
Yeah, it was really a lot of what I do with my clients in terms of just helping them change their communication styles. And I'll talk a little bit about, some of the roadblocks that I see with people when I start to work with them because of these dynamics that we create and these dances that we do with our family members. We all do it, but we get into that pattern. So yeah, that is great information. So I just want to thank Kim and Judy and Bob for, asking me to come on the panel and be a part of this. I have been be part of the conversation for many years. I walked into one of Kim's groups many years ago as a parent and a professional. I mean, I was in the field already, but when it's your own child, doesn't matter how long you've been doing this stuff, it all goes out the window because the emotional attachment is so strong, you cannot see clearly. So I love the work that Be Part of the Conversation does. I refer so many of my clients to the parent partnership groups because they're amazing. Love that they have the ability to go online because sometimes clients are from all over the place. So just real quick, I am an interventionist and an addictions counselor. Been doing this since back in the 80s, long time. And the intervention piece that I do, I think a lot of people get curious about interventions. And I'm sure there's some people on here who have done interventions on their family members. And, for me, I do two different types. I do an invitational model where the day before the intervention, the family member invites their loved one to come to a family meeting. Intervention holds a kind of a stigma to it, so I don't even like using that word. So I like to call it a family meeting. The other kind of intervention that most people know more about, the surprise model, the Johnson model, and where we just plan it without their knowledge, and then we just show up. And the reason that I do like the invitational model is because it can cut down on the anger that the person has. And when they get to the treatment center, it's a little bit less work for the treatment center to work through that anger. But both models work. I figure that out as I start to work with people, what I think would be best. But, not just the interventions, because I get a lot of families that come to me that don't know what they need or what they want, right? But they're stuck. And so, I feel like my job, whether it is an intervention or whether it is some coaching or counseling, is to help them get unstuck. So whatever that means for them, and hopefully together we can figure out the goals, right? What are your goals? What would you like to see happen? But I think that being, having a reset or a shift is the thing that is most needed. One of the things that happens, and to talk about motivation, is that these patterns of communication in the home just add to the problem and they're destructive. So if I can help the family member change, 9 times out of 10 families come to me and they want to know how to fix their loved one. What can we do to fix this person? Get rid of the addiction or get it, healed. But we always have to start with the family. So what is it that we can help you learn so you can gain some insight into how you got here, right? And how your loved one got here. And so it's really important that I provide some education so they can increase their knowledge base, which hopefully leads to some insight, which then leads to change and action. So just like the person who's suffering from addiction, as ever, most of you know, and I'm not telling you anything you don't know, is this is a family disease and it infects everyone. And it spreads through the family like a wildfire. And, part of the work is, part of the work is helping them understand that, because it's easier for us to point the finger and say, they have the problem. But, just providing some, education around how this affects all the family members, and how, a lot of times if it's the loved one is in the home, the home feels like a prison and they're being held hostage there. And the things usually that they're saying to their loved ones or doing are because they love the person so much. And if it's a child or an adult child, that's what we do. Parents protect, right? We want to protect our child. We want to help them. But things have to shift when you have a child that suffers from mental illness or addiction to a different way of helping. And so we get stuck in the pattern of, I need to protect them, because what if, right? It's always the fear that is driving the families, because if I do an intervention, will they never talk to me again? They will hate me. If I have to ask them to leave the home, will something horrible happen to them? And again, these are real fears, right? And I think it's important part of the work I do is to help them understand that we don't have control over what is going to happen, right? But I do know that most of the time that shift occurs during the intervention, so that then healing can come in. So it gets the family unstuck so something different can happen. And a lot of times we don't know what that will be, right? But I always say, even if they don't go to treatment, there's going to be a shift here, and you're going to do something different. And so you're going to show up different. You're going to, so that I really think that is the thing that we, many times they'll say to me, like, we don't have any hope. We don't think they're going to go to treatment. And I said, well, we can do this because you want to make sure you've done everything that you can to lead them to the, where they can get their healing. I would love to have Thomas I met Thomas 3.5 years ago when his mom needed an intervention, and he ended up going to treatment, which again is a miracle. And he can tell you, but I got a call from Thomas when he now has over 3 years, and I got a call from him when he had a year. Through the years, these calls that he, how good he was doing. And it was just so amazing to watch. So the process worked for Thomas. And, it doesn't work as good for everyone, but it works a lot of times. So again, the intervention, I think, can get a bad name because I think people are afraid of what might happen. But I think a lot of times those fears are unfounded, and with the right guidance and the right treatment, I think they can create miracles. So Thomas, why don't you introduce yourself?
Hey guys, thanks for having me here. Thomas, I suffered from addiction to substances and alcohol for years, and Yeah, luckily I had the opportunity to have an intervention that was facilitated by Pat. Um, and I think, what Pat was saying really speaks true to my experience where a lot of the work was done before the intervention with the family, um, and kind of like coaching the family on setting boundaries and changing the dynamic of the communication was really what sealed the deal for me. And yeah, I had been in active addiction, I would say, for probably 15 years, and had just reached a point in my life where I had really, well, one, I had no direction. I had no drive to find a direction in my life, and I was just kind of sitting in a a depressive state where I felt sorry for myself, but didn't want to do anything to change that. And I think a big part of why I got sober and why I decided to agree to go to treatment was because I was ready for a change and I was ready to have a clean slate. So, I think my mom doing the work that she did to set the boundary that worked for me. It was, either, you go to treatment or you can't live here anymore. I was living at my mom's house at the time. Um, and reality started to set in for me of what that would look like. And that's not what I wanted. But I just didn't know how to take the action to change and get sober. So I needed the help from someone other than me. And yeah, I was willing to to at least try. And I vividly remember when I was leaving my mom's house to go to treatment with Pat. She flew me down to the residential program that I went to. I felt just like a massive weight lifted off of my shoulders and like a huge it was almost as if I could breathe again, and this relief just kind of like started to wash over me, and I started to think, I can I can move on, and I can like, this is like an opportunity to start a new life that I'd kind of like fantasized about, but I never really thought it was possible with where I was at in my life. Um, and it was intense. Like it's a hard thing to sit in a room with your family and two strangers that are all like expressing a lot of love and um, a lot of love for you, and they're being like brutally honest as well, which is hard. um, but in the moment that's like what I needed, because my family wasn't really ever communicating with me in that kind of way where they were just really honest and um like Pat said, that fear of how your loved one might respond or react to the honesty. You have to do what you believe is like the right thing to do for that person. um and I was lucky that my family did. So I'm super grateful that I uh, I had that experience, because I don't know if I would have done it if it was a different way. And the method, I guess, my experience was like that invitational kind of intervention where my mom said, we were having like a family meeting, and there was I don't remember how she described it, but like a family kind of therapist thing. And I remember now that I had thought to myself, and I had like, these ideas of what this meeting could be. Um, and I was thinking it could be an intervention, but I still agreed to go because I had kind of run out of options, and I had tried like, you know, individual therapy, counseling, getting drug tested like weekly, multiple times a week. And none of it really worked because I didn't have like any kind of experience with, any kind of 12-step program or long-term recovery kind of structured living. So the change that I needed was to just have like a that shift, and Pat was, graciously able to help me and my family. Yeah.
So one of the things that when I did Thomas's, I was actually I did it with a colleague of mine. So there was two of us, which is always really nice.
Yeah.
So the Jonathan Rausch, if anybody's ever heard of him, the two of us did this intervention together, and it's so I love hearing your experience, Thomas, because I think the one thing that families, they're just so scared, and it is the fear of, if I do this, are they going to hate me? And then the second part of that is because when in an intervention, they're always, not always, but we like it when there's some leverage there, right? And we call it the bottom line. So we hope we don't have to pull that out, that we don't get to that during the intervention. So I will let the intervention go on for 2 hours or however long it needs to go on until I get to the point where I know this person isn't going today. And that's when I look to the family and I say, okay, so what, as a result of, and I'll use you as an example, Thomas saying that he will not go, I know that you've made some decisions, the family, and can you share with Thomas what you're going to do as a result of him making this choice? And that's the part where it's so, so difficult. The family in the situation like Thomas, when he was living at home and he was an adult, he was a young adult, mom was courageous enough to be able to say, you cannot stay here anymore. You have to pack your bag and you have to leave. And so, what I think that's one of the hardest things for a parent, because where are they going to go? What are they going to do? Are they going to, but it's many times I see it's the thing that makes the difference. It just makes the difference. I remember when I did this last year, and they said they weren't going to go, and we stayed there and we stayed there and we stayed there, and it was a young adult male too, and finally we knew he was not going to go, and so the dad said, I'll drive you to the homeless shelter, and he did that, and I went home. I was actually in another state. I flew home and I just worked with the family, continuing to coach them on what to say if he called or texted. And that's the advantage of an intervention, is you have this person that can really guide you every step of the way. And after 1 week, he called up and said, I'll go, and that's what I think families sometimes have a hard time seeing, is holding that line really, really does help. And, just be doing something that you would not do in the past, because by the time families get to us, they're pretty desperate and they've tried a lot of different things, but again, I continue to work with the family after the loved one does go to treatment, and to refer back to Brenda and the motivational interviewing, that is just the beginning, right? Like that's just the start point. From there, that's when all the, the hard part comes. While they're in treatment, you can sleep, right? You get 30-day, if, for a lot of, the younger adults, it's a lot longer, but you could sleep and but they have to know that that dance that they used to do no longer is going to benefit their loved one or themselves. So how do we help you to change that dance? When you talk about using I statements and, one of the things that I loved about when I took this, the BOM coaching course was, just questions, open-ended questions that can get somebody talking. We're so good as parents at telling our kids what to do, right? Got to do this or don't do that, or, and just flipping that script and letting them find their way and being the person, like Brenda said, who listens and, is able to hear the person out without. And, so I think it is so important. There's so much that can happen with the family that will strengthen the relationship, change the relationship, help that the family be in a recovery process. Because again, those patterns don't work anymore. If the family doesn't change, then, it's really hard for the person who's in treatment to keep that change going too. So, one of the things that I do with families is really try to get them to the place where they can realize that, like light bulb moments, like that's what I love. I love these light bulb moments because, I was working with a family and, a lot of times you'll hear where they'll throw out their drugs or throw out the alcohol or maybe just bug them to go to counseling. And, it's like this, it doesn't work. It doesn't work. And so, having a parent tell their 28-year-old, daughter or son, you shouldn't drink or, you shouldn't do this or you need to go to counseling or it's something different has to happen. And there has to be boundaries set, and that's, I think, taking the power back in the house, when the power is all in the person who is addicted's hands. And how do you get that back? Because the person in the addiction knows if they scream or yell or resist, that's going to shut you down. And that gives, that kind of gives them control of the home. So you're being held hostage in your own home. And how do you take that power back? Because you really can't control what they do. You can only control what you do. And that's where the change comes. We stop trying to control what they're doing and control what we do. And I love what you said, Thomas, about the boundaries, right? It's so important.
Yeah, it really is.
We set boundaries for us. They're things that protect us. Mm. It's not to tell the other person what to do. It's for us. The boundaries are to protect me. So there's some really awful situations where somebody might have, a really serious mental illness. And there's a lot of, with the THC level out there in the weed. And I know, Kim, you do a lot of programs on this where they have psychosis and, the parents are at a loss. And you can't keep someone in the home who's suffering from psychosis and is continuing to use. You have to figure out a way to get them where they need to be to get that help. So, yeah. So I'm not really sure what else I can say about, so much of what Brenda said. The coaching for me was a different way than drug and alcohol counseling tends to be very directive. You got to do this or this. And the coaching for me gave me another angle to talk to people and work with people. Because one of the things that I think that I have to do with families is to help them draw their power, know that they have power. So I'm trying to empower them. And that's what coaching is. It really is about, you have all the answers inside. Yeah, you need some education about the illness and those kinds of things, but you really do know. And, so being able to, coming from a strength-based model, you guys know what you need to do, right? You know what the answers are. They just a lot of times need the support and the encouragement to, and it breaks you down. Addiction in a family, in a home, just breaks you down to where you are so much suffering that you can't function. And so when that is the case, the only thing you can do is step away and work on yourself. And, again, that's, a lot of times it's hard for the person to hear that and to do that because the focus has been on the other person for so long, and trying to control their addiction and what they do. So yeah, I like, again, just to finish up on the coaching piece, asking those questions of someone, like, if a question might be, what are the costs to you if you don't do the intervention? What are those costs? And helping someone just be able to think about things in a different way. And that's what I think, coaching can help the family do. So that's kind of all I really have. I would love to just take some questions, and for any, for Brenda or Thomas or me or Kim.
Yeah, I do see we have one question already, but I want to ask Pat, when do you know, when you're working with a family, that that maybe an intervention is not appropriate?
Well, it's interesting because when I start with someone, I always tell them that I don't just do interventions. I also do coaching. So, and what I'll say to them is, maybe we need to have a session or two to figure out if intervention is the right thing. Now, sometimes when I get that call, they know they want to do an intervention. It's appropriate. I can tell from what they're telling me, but sometimes I don't. So I will say, why don't we do a couple coaching sessions, and then we can possibly get to that, and then we can make that decision. It's really hard, like mental health. Like, I've done interventions on people that were in psychosis and, some even schizophrenic. It's not the best model. It can work, and sometimes it is the only thing that you can do to really get that person to treatment. But I think you also have to handle it in a delicate way. So, like, sometimes even if I had a really hard case up in New York, and I had done coaching. It was two moms, and I had done coaching with them for a couple months. And I knew how hard this case it was some drugs, but it was also mental illness. And I brought Jonathan into the case because him and I sometimes work on cases together. They were fine with that. He came in and we did the case together. So sometimes I will do that because you kind of have to think outside the box. The regular model for addiction sometimes doesn't work for every case. So I hope that answered your question. Yeah. I think an intervention can be so many things, and it doesn't have to look exactly like what you see on TV. It doesn't really look like that. So yeah, I think it's something that I have to, this takes a lot of, just, we feel our way. And I tell the families that, like, this is not an exact science. And I'm going to, we don't know exactly what's going to happen when we're there. But yeah, it's kind of just using your own judgment from my experience as to whether I think it can work or not.
That makes sense. Thank you, Pat.
Yeah.
So someone asked Thomas if you could share a little bit more, and what they asked specifically was, what was your tipping point and what was your sobriety plan?
So my tipping point in terms of, I guess, being ready for sobriety Um, I would say it was this sort of internal deep level of depression that I just been digging over the years. And it got to a point where I just think, I told myself I didn't want to feel this way anymore. And I don't really know when that was, but something happened uh, where I knew that I wanted to get better, um, but I just didn't know how. But yeah, I would say the tipping point was this just this level of depression, um, and sort of like pitiful sort of demoralization that I had been feeling that just had been building over the years. And I just was ready to kind of, move forward from that. Um, and what was the other question? Sorry.
What was your sobriety plan? So I guess treatment plan, that sort of thing.
In my experience of like my current sobriety.
I believe so.
Yeah.
Must be.
So yeah, what my experience was that I was looking for long-term recovery, long-term sobriety, and I wanted to, uh, have the tools and structure in my life to be able to stay sober for the rest of my life because I didn't want to ever go back to living the kind of life that I was living and feeling the way that I was feeling. So I went to a residential um, treatment center. Before that, I was in detox for about 5 days or so. So yeah, I went to residential, and then from there went to a structured sober living, which was also on the longer term side, which was 12-step AA based, yeah, structured 12-step based. And they really focus on yeah, like building a really solid foundation in 12-step recovery, that would give me the tools to you know stay sober the way that I wanted to stay sober. I wasn't looking for just to get in and out of treatment and stay sober for a couple months and then see if I could manage my life again using, but that wasn't what I wanted. I wanted to just have a complete, 180 and go in a totally different direction. That I wanted a healthy life, and I wanted to, have some peace of mind. And on the side of it, I also give like my family peace of mind. I remember when I was in residential that I felt proud of myself, not only because I was getting sober for myself, but I could, my mom and my dad and my siblings could like sleep at night knowing that I'm safe and I'm healthy, which was also a big part of why I was doing what I was doing. So, yeah.
Thank
Tom,
you.
real quick, I have a quick question I wonder how much the treatment center
Mm-hmm.
terms of your and as opposed to your in because it sounds like you had it, and I talk a lot about this with clients, is the internal versus external motivation. Sounds like you had a lot of internal motivation. How much did that help you, and how much did it matter where you were in terms of the treatment center?
I think the treatment center uh, can matter on a certain level, but at the end of the day, it doesn't it won't make the difference of whether the client wants to be sober or not. Like they have, like the internal motivation really was the difference maker. And I had a great experience and very, fortunate to have had a really great experience through the treatment centers that I was in, that helped me. But I think, and again, I think it comes back to the work that the family does too, that helped me to come to acceptance and surrender in my own process. And then the lights kind of come on in my head where it just starts to, I connect the dots and it makes sense, why I need to do this for myself first and foremost. And like, the motivation sort of like develops itself through that process of like the family helping me to my family helping me to, make a decision for myself, but them also like showing their support and love while holding a boundary that's gonna like be healthy for them and healthy for me too. Yeah.
Great.
Yeah.
Thanks.
Yeah, I just want to
Yeah,
say
please,
that,
go ahead.
Thomas, what you're describing is that motivational balance. You even use the word tipping point, and then what I heard was you talking about your internal motivations. And even earlier than that, hearing that change talk of, I didn't know what I needed to do, the how to do it, but I knew I wanted something different. And that's just something I wanted to emphasize for parents. Like, that's what you're listening for. And you get that when you offer a space for someone to talk. And it can kind of go, if you're thinking of what you're going to say and jumping in, you can miss that little nugget right there. And that is, to me, I see that as the little flame that's buried down deep inside. And I want to fan that flame and bring it out and say, well, I'm hearing this. You're, like I said, you're unsure, but at the same time, there's a part of you that wants your life to be different. And then you can, again, allow the person to speak, and then up comes something else that you can reflect on. And then, what would your life look like? Start having them envision, what would your life look like if you were to make a change? And you start to shift them from all the negative to like the positive. What could I, and that again really can help people again shift that tipping point in the motivation. And then again, you eventually spoke about your values, how important it was for you to stay connected to your family, and you started to gain an awareness of what your family was going through and how that connection, and for you valued that connection. You want that relationship and to repair that relationship with your mom. So again, that becomes what I was hearing, motivation for you to like you said, not to just get sober, but to make this a long-term, sustainable recovery. So I just wanted to share some things that I thought, what we're talking about with the internal motivation and that tipping point, and how parents can help. Again, just lifting something like that up. It doesn't seem like a lot, but it can start the ball rolling and make it easier for someone like Pat or another therapist to kind of, you're more on board. You're not fighting so much of that resistance.
Thanks, Brenda. I love this question. Well, first I'll ask the other question. Where in New Jersey are you, Pat?
Oh, so I am between, well, I do most of what I do virtually, except the actual interventions, but all the coaching is virtual, unless there's somebody who's close by to where I am and they want to meet someone. I do like a first time meeting, like at a coffee shop if they want to meet in person, but I am between Southern New Jersey, like down by Ocean City, and also in Montgomery County, Pennsylvania. So I go between those two places.
Thanks, Pat. So this is the question that I love because it comes up so often. How can you get everyone on board for changing or supporting addiction? So one parent has addiction in their family of origin and understands it as a disease, whereas the other parent does not think it's I'm sorry, does not have that history and thinks that their child can just stop and is being difficult. And we hear this so often. And I'll just share my 2 cents really quickly. And because I've seen this come up so often, a lot of times we go to parent partnership or Al-Anon or Nar-Anon together or just alone. And we've got the other parent at home and we're there like doing all the research and all the worrying and all the hand wringing and all that kind of stuff. So if we can ask that other parent either to join us or even to find their own meeting, I think it helps a lot of time to have, instead of being in the room with the other parent, because we might not be focused on what I need from that meeting. Rather, I'm kind of thinking about making sure they're getting the message here, right? That's one piece, but just talking to a coach. And Brenda's a certified family recovery specialist. I am. Judy Hirsch, who's on this program as well, is also one. And Pat does loads and loads of family coaching. So just talking with a not only a professional, but just an objective person that you're not married to can be incredibly helpful because there's such a bias when we have a history with our partner, with the other parent, but I would love to hear, Pat, I'm sure you have some thoughts, or Brenda, Thomas, anybody. What do you think about that?
I get this all the time where, and not to stereotype, but a lot of times it is the husband that we have to try to get on board because maybe he doesn't believe in counseling or any of this stuff. And, again, it's tough. It's really tough because when you have two parents that are on totally different pages and they have an adult child or, even an adolescent, and they have to come together, right? And we have to figure out a place where they can come together in some agreement. So for me, a lot of times, it's building that trust more with that person if they're willing to at least get on and do some coaching. And if they'll do that, I try to bond with them so they can see that this is not that scary of a process, and then just really kind of side with them. I had this one case where they said this, nobody can, this has been really difficult. He doesn't like to talk to anybody. He walks out, he won't see them more than once. And I was able, and the wife was kind of like, you can throw me under the bus. So like I would kind of make, little jokes at her or throw her under the bus a little bit. And, I was able to kind of get him on board, right? And to be able to understand. And, it isn't easy though, because there's that dynamic there. And then a lot of times the case I was talking about in New York that I did with Jonathan, it was breaking up their marriage, and one person was on one page, one was on the other. And so, we have to figure out how to, because then you have the addiction and the mental health issue, but then you also have the problem in the relationship. So it's a lot. And, trying to break that down to really figure out where do we start, and what can we do to get to the place where they can kind of join together to help the loved one.
Perfect.
And one person's, sometimes the easier one, right? Doesn't set the boundaries and, those kinds of things. So.
Love it. Thank you. Pat, this is for you as well. Do you do counseling for someone who is sober, but stuck, and this is such a great question too, stuck and unable to move forward with finding their way to independent functional living?
Yes, I think. I mean, I would have to hear a little bit more about, I do also, besides the families and, coaching and the interventions, a small part of my practice is working with people who are getting sober. Like I have a guy who's going on almost 2 years and I'm still seeing him. I got him into a rehab. He came willingly and there was no intervention involved, and he's, doing great. And I have a few women like that too, that I work with that, are sober. And so it just depends on the case. One of the things that I feel very strongly about is, I don't ever want to take a case that I don't think I can help the person move, to their desired goal and move forward. And usually what I'll say is, maybe we could just do a session or two and see if you feel like, because the connection in working with someone is probably the most important thing, right? How you connect with the person. And if somebody doesn't connect with me, and needs somebody different, then I'll refer them to someone else, because again, the most important thing is to, get them what they need. So yes, I would definitely do that.
Right. Thank you, Pat. Thomas, question for you. Was there a point early on when perhaps you didn't think that you had a substance use problem? Do you think that the intervention would have worked at that point? Like if you were in denial, basically, or do you think that the intervention and going away to treatment was because you were already thinking about getting sober? You said that none of the previous outpatient therapy before that was working at all. Why do you think that was?
That's a good question.
It is.
Yeah. Well, early on, I did not think I had a problem, excuse me, with drugs or alcohol. I kind of just thought it was like, my lifestyle, and I was in my early 20s. So, I thought, oh yeah, all my friends are doing this and this is just kind of normal. Um, so it was like, they say it's like it was fun, and then it was fun with problems, and then it was just problems. Um, and that was my experience. But my parents separated when I was, I think, 21, and they were going to get divorced. And that event kind of just sent me into a spiral of like resentment and depression and all these different, really intense emotions. Um, and that was kind of like the event that where I just started to accept that I was, I kind of told myself like, okay, now I'm just like an addict and an alcoholic. Like, this is who I am. So I didn't really think that I was, I don't think at that point I was in denial. But then when my mom, um, you know, kind of was expressing all this concern about my behavior, I was so scared to face reality to her and to like my family that I was like, outwardly in denial. But internally, I knew that it was true. So it was like this difficult like battle within myself that I was trying to fight. Excuse me. But at a certain point, there was like no hiding it. Like it's just I had to look at reality and kind of just surrender. Um, the intervention um, definitely back then wouldn't have worked. I was not ready, and my experience was just that I had to suffer, and I had to suffer enough to become willing, and but it doesn't have to always be that way. I think it really just has to come down to when you decide to kind of like stop digging, um, to hit your bottom, when you find the willingness to make that change. So I think it happened when it needed to happen. Um, you know, and I get asked too, like, you know, would you have rather gone sober before you did, like earlier? Um, but I honestly like, and I had some good times, but I also had a lot of bad times, and the experience of what I went through, I think, shaped me into who I am today. Like, if I didn't suffer the way that I did, I don't think I would have had as much internal like motivation and perspective and like willingness to have done this. So I guess it just happened the way it needed to. Um, and the last part of that question, Yeah, I guess it kind of ties back into, well, I think there's a few different layers to answer that question. The outpatient, therapy or counseling that I was doing weekly, I don't think it was working because one, I was still getting high, so I'm not going to be honest about how I'm feeling if I'm getting high. I'm not going to be vulnerable. I'm not going to like trust someone else to listen to what I'm saying because, you know, I know what's best for myself. And also, what was I just going to think about? It also wasn't working because I was living at my family's house, my mom's house. So I had in the back of my mind that I had this level of comfort and safety, this like safety net to fall back on if things didn't work out. And I was like not really able to hold down a job, wasn't able to stay sober, obviously. Had kind of like, lost jobs over the years due to my addiction. And, I think having that safety net to fall back on just was an excuse for me to not really like invest into those programs or that counseling or therapy that I was doing. Because if it didn't work out, I still like can just get high. And I have like, my family to like support me. So um yeah, I think that was a big part of why um why it wasn't working because I wasn't really taking it seriously. I was only doing it because I was, you know, kind of being told to, and I wasn't doing it because I wanted to. Um, so yeah,
Thomas, I just think that's such a great point of, how helpful it was when your mom said you can't be here, right? It's that
yeah,
back that, and that's what I say to parents all the time. It's like, it's not helping them to be in your home. It's
yeah,
hurt. So the other thing I really want to say that you had mentioned about the timing of the intervention, I find, and this blows my mind every single time, when families come to me and they're ready to do an intervention, the timing is always perfect. Like, I don't know, it might be crazy to even say that, but it absolutely is always perfect. And the other thing is, a week before the intervention, almost every family calls me and says, "Oh my God, they're doing so much better. I don't know if they know about it but do you think we should still do it?" And I'm always like, this happens every time because the energy when you're preparing has shifted, and something has shifted, and it happens almost every time. So yeah, I just wanted to say that. Blows my mind.
Can I just jump in for a second to comment, Pat, that to me, that speaks to the coaching. You're coaching that family before, and that is happening. They're changing the way they communicate, the way the perspective shift, everything. And like you said, you're preparing them so that they can, hold those boundaries and be that support at the right time. So, just picking up on the timing of that you're spending that time with them and then seeing and hearing the difference. Yeah.
Yeah. Thanks, Brenda.
I think it's worth mentioning too that, after 15 years of attending parent support group meetings of some kind or another, I've heard so many times people say like, well, they're never going to get sober if they don't want it. And they're never going to go to treatment unless they have to hit bottom before we, please, let's not wait for them to hit bottom. Perhaps I know I hit my bottom when we did our intervention. I was not able to watch my son go through this anymore. He had no interest in getting sober at that time. But yes, ultimately he has to do the work. It is up to him to embrace this, to do the heavy lifting, to do the work themselves. But the whole purpose of an intervention is to say, like, we need to step in and help them to make this decision for themselves, because if we wait, that, I guess I'm just trying to have this like cautionary note that, like, if we wait for them to be ready on their own, I've heard stories where that can happen, where somebody actually says, like, hey, I need help and I need to get to treatment. That's great. But so often it really is all those external influences that at least get things started, at least open the door, to start the process.
Yeah, I did one on my daughter, or I didn't do it, but a friend of mine, another interventionist, did one on my daughter, and she had no clue. We did a surprise. She had no intention. She was in denial, and she went into that rehab. And I got to tell you, I tell this story all the time. I went to visit her after she was there for about a week and a half, and she saw me and she looked at me and she said, "Oh my God, Mom, this is the best thing you have ever done for me." And it was just so, and she had no intention of getting sober. She probably didn't even realize that we knew she had a problem. And so again, like Kim said, don't wait. I think it happens at the time it's supposed to happen, when you're sick and tired of being sick and tired.
Exactly. This question is for Brenda and/or Pat. What if the adult child has had some traumatic experiences in psychiatric hospital and inpatient recovery settings and adamantly refuses to go into detox and treatment?
Do you want to take that, Brenda, or you want me to?
You take it, Pat, with all of your experience. I'd for your answer too.
That happens sometimes. I think that, the psychiatric hospitals can be so traumatic for people. And that's why, again, it's educating about what the difference is between a residential program and a psychiatric hospital. There's such a huge difference, right? Like these programs, and Thomas can speak about, voyage recovery. I mean, it's like these places are amazing, and the setting and a lot of times they're beautiful, and there's rolling hills, and there's so it's nothing like a psych hospital. It's voluntary, but again, you have to be cognizant of that person's experience and their trauma. So again, that would be coming up with, if an intervention was indicated and they were going to go to residential, it would be part of the process of helping them understand how this would be a different experience. But again, it could be a situation where maybe an intervention would not be indicated, and I would take a lot of time and energy to try to figure that out. So I hope that answered the question.
Thank you. What is the best way to get started with an addiction counselor? I'm wondering if this question is for a family member or for the individual who is in need of treatment. I would say the very first thing is to make sure that you're finding the right person that fit in it, and actually leads into another question that was asked directly to me, but I'll pose it to you. Oh, for the family member. So looking for, I think Psychology Today is a pretty good place to start if you're really just looking broadly to plug in, like, are we looking for addiction? Are we looking for mental health, specific mental health challenges? And someone actually had just messaged me asking about eating disorders, to somebody who, and is that something, Pat, that you've encountered where there's a co-occurring eating disorder with substance use? Okay.
Absolutely.
And there are treatment programs, though, and counselors that have very specific specialties. So maybe that's one place to start, but any other thoughts about how to navigate that for family members to find the best addiction counselors?
I mean, I think if they're in, depending on where they are, I know I have contacts all over the country. So, if anybody ever is looking for something, you can reach out to me and I'll see if I can help guide you. Yeah, I mean, it's, me and Kim and, we know all the people on the main line, and I know a lot of people in Bucks County. And, so there's, in our area, I know down at the beach where I live, I have some resources. That's a newer place for me, so I don't have as many, but I know people that know. So it's just, reaching out to someone who, you encounter with any of these programs or groups, and, they'll help guide you. Psychology Today is a good way to start, but again, it's not, you don't get that recommendation of,
Right.
person is really good. So, but feel free to reach out anytime.
Yeah, I was just going to say, like, see if there's a parent support group in your area. I joined one in mine, and I was able to use them as a resource, which was really helpful. And so those external resources are everywhere. And now, of course, you can do a lot online too. So.
Right. Yeah, we have lots of them online. Here is a note from Thomas's mom, in case you aren't looking at the chat. I'm Thomas's mom and can say that Pat is a great resource for the family. Part of the prep work is sourcing programs that are possible good fits based on your loved one's needs. Beautiful. Thanks for sharing that. And I just put all of our links in the chat again. This flew by. I can't believe it's 8:30 already. Thank you all, Brenda, Pat, Thomas. You're amazing. Really amazing. Thank you so much.
Thank you. And thank you for all you guys do. It's amazing. Kim, and be part of the conversation, is unlike any other organization. She is a workhorse, and her heart and soul is in this. So, yeah.
Yeah. No, your passion shines through, all of you. And thank you for being here. Yeah. That's resilience in action right there.
Great way to put it.
Thanks
Thanks,
for having me
everybody.
on here, guys. Appreciate it.